Hi Jane, you're here for your yearly physical and your thyroid lab, your TSH level, came back a little high during your physical blood work. This just means that your thyroid gland isn't making the thyroid hormone that it should. Your T4 blood level, which is your thyroid hormone level, was low, which means that your thyroid hormone level is being made isn't enough. You have an underactive thyroid, which is also known as hypothyroidism. So I'm sending in a medicine for you to the pharmacy called LEVOTHYROXINE. This is a medicine that you will be on for the rest of your life. And I know that it may sound a little overwhelming, but let me explain a few things to you. It is especially common for women to have hypothyroidism and be on this medicine. If you have any questions along the way, please feel free to stop me. What this drug does to your body is that it takes the place of the hormone and it changes how your body uses up the energy by making it faster. The drug can make some changes in your body, like being taken in through the small intestine and turning it into the active hormone in some of the tissues in the body and the liver. A small part of this drug is taken in through the stomach. People that have a short, small intestine, like those who've had bowel surgery before, where part of their small intestine has been cut off, have a lower time frame that it goes in and need a higher dose of the drug. This way, this drug is sent to different areas of the body that is taken in from the gut. Then it connects to the little proteins that carry it and then give off the hormone, and then go to the cells where it can be turned into the T3 hormone. The way of metabolism of this drug is to remove the iodine. It's how the drug is turned into the thyroid hormone. The way that this drug is taken out of the body is that it's pretty long time for the body to get rid of half of the drug. This drug has some responses in children and patients over 65 years old. These responses are rashes, hives, blisters on the skin, fever. You might experience tight chest, maybe some trouble breathing, talking or swallowing, and any swelling of the areas, lips of the face, throat and tongue. Fast heartbeat, shortness of breath, swelling of the arms and legs, weight gain, tired or weakness, upset stomach, nausea, diarrhea, throwing up, changes in mood, having trouble sleeping, sweating, not being able to tolerate the heat, weak muscles and cramps, hips or bones. Some special things to keep in mind for children and patients over 65 years old at the time where you may be taking the drug is to also take it on an empty stomach about 30 to 60 minutes before you eat. Taking it at the same time every day is also important to keep the thyroid levels in a good place. Think about the foods that this drug will also not be good with. Stay away from foods with soy, walnuts, grapefruit juices, and fiber when taking this drug. Keep this drug away from any other drugs. Other drugs that may not be good with this drug or that may change how this drug works. So it's important to take them 4 hours apart are antacids and calcium pills, drugs that help lower cholesterol. So if you're on any of those as well, iron pills, drugs that are used to help with stomach ulcers, or if you have any, and if you take any weight loss drugs. Make sure you take all these medications at least 4 hours apart from the levothyroxine. Another thing to think about is if you're pregnant or breastfeeding. And since you are breastfeeding, it's good to know that it is safe to take this medication. You will need a regular blood test to check your levels regularly for the thyroid hormone. This will tell us if you're on the right dose and just let us know if we need to make changes as needed. If your dose is too high, you may have signs of a thyroid that is too active. If those signs would be feeling nervous, fast heartbeat, excessive weight loss, shaky hands, and anxiety. Another thing to think about is to stay with the same brand that we prescribe you. Switching brands can affect how the body soaks it up, so that's also things to remember. I know this is a lot to take in, but if you have any questions, please feel free to ask me. Also, if you think of any questions after you get home, please call my office and leave a message with my staff, and I'll be happy to get back to you. Okay, Jane? Thank you so much.